My name is Stephen Meyer. I'm a palliative medicine specialist and I practice at Strand Medical Center. I went to Windsor University School of Medicine, which is based out of St. Kitts in the West Indies. It's the 7th smallest country in the world, and you can drive the circumference of it in about 45 minutes. I did that for 2 years, where we do what you call your basic sciences, which is mostly your book work and your anatomy labs and things like that. And then I did all my clinical rotations within Chicago, Illinois. And then I ended up staying in Chicago for my internal medicine residency, which is my primary specialty. And then I moved up to central Wisconsin at the Marshfield Clinic Health System, where I did a fellowship in hospice and palliative medicine. And I'm forever indebted to the attendings that I had there. They actually are two of the first palliative medicine physicians in the United States. And the program that they started was the first one opened in the United States. And palliative medicine was invented by a man by the name of Balmount, Montreal, Canada, and my chairman trained under Balmount, and I felt like that was a good place to get training, and it really was. I will always be forever indebted to those men, and they taught me how to care for the terminally ill, seriously ill, and the critically ill with passion, caring, and respect, and making sure that we see not just patients, but their whole family as a unit. And that doesn't just mean symptoms, that doesn't just mean a disease. That means the physical, the emotional, the spiritual, the psychological, the social, and the transcendental components. You have to look at all of those things, and being able to address all of that really solidified my love for palliative medicine, and I get to do that on a daily basis. I often tell patients and their families that the most important thing that I feel like we need to be doing as providers is providing good care. I think that's a word that's not used enough, and that it can mean different things to different people. And so the philosophy that I take and the approach that I take is to find out what good care means to someone or to their families, and make sure that that's how we're caring for that person. The best part of my job is helping relieve suffering and helping people find peace with their illness and with their families in serious states of illness.